Penrose Jackson. I'm currently Director of Community Health Improvement at Fletcher Allen Healthcare, and I've been associated with the initiative nearly from its beginning, and first in my role as President of the Vermont Health Foundation. It's hard to believe that the Champlain Initiative was created some 16 years ago, and it's hard to remember what it was like before. We worked just as hard, we tried just as hard to live in a wonderful community, but there were in fact trends that were bending in the wrong direction. The early work identifying those trends and then saying what can we do to bend them so they move in a better direction it's hard to believe, but it was eye-opening at that time. And collecting people, as the Champlain Initiative did, very intentionally around bringing people from disparate parts of the community, different ages, different walks of life, different socioeconomics, together to mutually problem solve was amazingly innovative and frankly pretty progressive. We did it then, and now, today, a lot has changed just because of bringing people together. There was fear when Fletcher Allen was starting to be created in the mid-1990s that we were creating a monolithic organization that wouldn't care about the other very important efforts that were going on in the community to help people live more healthfully. Around that same time, people were starting to identify the social determinants of health and recognizing that what keeps us healthy isn't health care. It helps us stay healthy or prevents illness, but what keeps us healthy is the communities we live in, the safety of our community, the water that we drink, the air we breathe, and frankly, most importantly, our personal behaviors. So that was all starting to come together, and Fletcher Allen, I'm very proud to say, realized that very early on and said, we can't do it alone. We can only have a healthy community if we support healthy community initiatives that bring people to us that are more capable of maintaining their own health, and when they do get sick, they have the community supports they need to live as healthfully as possible. So much more has gone on in the intervening time around the health disparities and the social determinants of health. In some areas, we still have a lot to do there. We've come a long way, we're having the conversations, but I was just talking to someone recently about how we may be there intellectually, but the kind of the rubber on the road and the way we behave sometimes is different from the way we believe people should work together. We're concerned about the way we're building our communities. We're concerned about people's disconnection from their neighbor. We're concerned about kids that don't seem to have the assets they need in order to prosper and grow into successful adults. And it really kind of grouped organically with a little bit of guiding from the leadership into work teams. And another piece of the genius, I think, of the initiative, it was we're not going to exist as an entity that will do things. We're going to exist as an entity that will facilitate other people getting together to do good work. And I remember one person very early on going into a meeting, and I think she was facilitating it and talking about some goals, and I think it was around helping kids get assets so they could be contributing members, and the people in the committee kept saying, well, you should do this and you should do that, kind of pointing at her, and she pulled a mirror out of her pocket and held it up back at them and said, we are you and you are we, and we need to do this together because we can't do it individually and alone. And I think that concept of we can't do it alone, we only can do it together. And very early on, it was people like Martha Maxim that got us with the mantra of who's not at the table. Some of the outcomes are kind of forgotten because they've kind of become who we are. Things like Get on the Move Vermont was started with the Champlain Initiative, a lot around information referral that resulted in Vermont 211 service. And because there wasn't a label on it saying this is a Champlain Initiative project, people have tended to forget that. And I think building these kinds of changes in our infrastructure were very important. The current challenge is what are those ones today that members of the community can come together to really own and solve. And when you get into some of the more, not institutional, but in kind of the character natures of our community, again, I said earlier that we're intellectually, I think that we're really egalitarian and progressive, but sometimes our actions don't meet our intent. And that's harder because it's harder to ferret out, it's harder to have a project around. Having said that, again, I think the Champlain Initiative created an environment, a way of problem solving together, and I've recently been involved in the ECOS project, and I was marveled. We were at a meeting about a month or two ago of the steering committee, and I actually said in that meeting that 80 people or so in that room, that we would not have been together in that room 20 years ago. that it was the Champlain Initiative that gave us the architecture upon which to build these events and activities, and hopefully that will continue going forward. The precepts that we brought together, the dedication to wanting our community to always be better, to be more inclusive, will not change and will only grow and expand.